Good afternoon, everybody. I'd like to welcome you to the latest in our FSU College of Medicine, Behavioral Sciences and Social Medicine Community Round Series. This one's entitled Mental Health in Our Community, Access, Quality, and Resources Across the Lifespan. We have a very accomplished panel of speakers today who will demonstrate what I think the breadth of the wonderful work going on in our community. So I think it's going to be a great session, and I will turn it over to Dr. Flynn.
Thank you, Dr. Howard. I'm delighted to focus our community rounds today on mental health. It's a topic that everyone is concerned about and talking about. And we have some fantastic resources and work going on in our community, and we're really excited to share that with you. I want to start by acknowledging our wonderful planning committee for the round series, Dr. Bryant Howard, who will be our moderator, part-time moderator today, Ms. Uta Horn-Hoflich, Dr. Meredith Fuller-Burgess, and Dr. Megan Dyken-Hansen are a part of our committee. We have a special session today in that all of the presenters, which we will introduce momentarily, work with the Mental Health Council of the Big Bend, chaired by Dr. Jay Reeve, CEO of Appalachia Center. Dr. Reeve, would you like to say a quick hello?
Thank you, Dr. Flynn. I appreciate that. Yes, I'll try to make it quick, and that's not easy for me, as many of you know. But I'm so pleased that FSU elected to have folks from the Mental Health Council on this, led by Dr. Flynn. The Mental Health Council of the Big Bend has been around for about 8 years now. We have an extraordinarily vibrant and engaged group of folks who represent 22 organizations in this community. And so I'm looking forward to hearing from our spectacular panel. It is an honor to work with you guys. Thank you.
Thank you, Dr. Reeve, and we've loved working on the council. So the presenters today, and all please mute your phones if you're not speaking. Thank you. So Dr. Franti Close and Ms. Nicole Everett and Ms. Courtney Atkins and I are all going to be speaking. We put together a session that's focused on lifespan, mental health and the lifespan, but with a real focus on community partnered efforts to address mental health. So I'll speak about pediatric and maternal mental health, start with some general mental health tips. Ms. Courtney Atkins will talk about our fantastic pediatric behavioral health navigation program. Ms. Nicole Everett will talk about our new community mental health navigation program, and Dr. Franti Close will spend time talking about a very important and under-addressed topic of men's mental health, especially African-American men. And she's leading some amazing things in the community in that regard. So without further delay, I will get started. If you don't know me, my name is Heather Flynn. I'm a clinical psychologist and professor here in the Department of Behavioral Sciences and Social Medicine and chair of the department. And I direct the Center for Behavioral Health Integration. And I will go ahead and begin. Can you see this, Dr. Reeve? Okay, great. So I thought I'd start with some definitions. You know, people are talking a lot about mental health, mental illness, sometimes using them interchangeably. And there are numerous definitions, but clearly mental health is more than the absence of a mental health disorder. There is no health without mental health. We cannot be healthy without mental health. And, you know, it's determined by a number of factors, most of which we don't fully understand, but socioeconomic, biological, environmental. And there are effective and cost-effective public health and other intersectional strategies to promote, protect, and restore mental health. And again, during this pandemic, it's more important than ever and more visible than ever. And there's tons of attention and funding and new services. So this is a really important time. I just want to add to the definition by talking about, again, the multiple factors that relate to mental health. For example, violence and socioeconomic pressures, sexual violence. There are a whole number of discriminatory, environmental, gender, racial, medical health, human rights violations. All of these things set up risk for poor mental health. And again, we can't function well without it. There are psychological, biological, personality factors. But one way to think about it is mental health is a state of well-being, which is a term being used now more, in which a person realizes his or her own abilities, can cope with normal stresses of life, whatever normal is, and can work productively to make a contribution to community. And lots of things can get in the way of that. We also sometimes hear pressure, stress, mental health used interchangeably. One thing I've learned from studying the concept of stress for many years is there's no one way to think about stress. Whatever you find stressful is stressful. And so, it's really important to pay attention to, for each of us to pay attention to what are those things? What are those things that leave us vulnerable? There's a whole different, there's a whole array of definitions. Stress doesn't just include the pandemic or major life events. Things can happen on a day-to-day basis. There's intergenerational trauma, racism, discrimination. All of this stuff can be put under the category of stress. But good news is that there are a number of coping skills and resilience factors that can support mental health. We could spend the whole day talking about these, but I thought that I would list a few sort of in order of importance. But again, everybody is different. But some of the things that keep emerging as really important for wellness. Number one, I would put at sleep. And I'll talk a little bit more about sleep, but regular restorative sleep is really vital for your neurobiology and for functioning in general. And everybody knows that if they've gone a few days without sleep, you can see pretty much every aspect of your functioning start to change, and not in a good way. So sleep is the number one. And when we talk about perinatal depression, sleep is a major factor there. Physical activity, not necessarily exercising, but moving your body, moving around is really vital. And especially if those activities, yes, exercise, but especially if those activities are things that you find take pleasure from or enjoyable. But that's very vital. Human bodies need routines. Routines are a way to trigger our brain to function well and our body to function well. Everything from our tear production, our GI system, everything runs on a 24-hour clock in our bodies. So the sleep and the routine really does help trigger and set some of those important functions in the body. Everybody knows, and especially during the pandemic, this has been quite obvious, that feeling isolated is very bad for mental health. Social support, laughing with your friends. This is something we can't compromise on as humans. We must feel a sense of connection with others. And anything that gets in the way of that is not good for wellness. Things like meditation, mindfulness, prayer, taking time to restore your brain and your body. Diet, nutrition plays an important role. But really, everybody should, if you haven't already been thinking about this, think about what for you do you need to build in every single day to feel like yourself, to feel like you're centered, to feel well. And those things are non-negotiable. Whatever else life throws at you, it's really important to prioritize those things that make you feel well. I thought I would just, because of the importance of sleep, spend a couple minutes on some tips. You probably already know this, but this whole issue of sleep hygiene is really important. Having a wind down routine, trying to avoid those blue screens for a couple hours, getting rid of those anxieties before you go to bed. Your sleep environment should only be for sleep. It should be cool and dark. And unfortunately, depending on who you are, having a drink of alcohol before bed may help you fall asleep, but it interferes with that restorative deep sleep. So that is something to try to avoid. I'm going to move now from mental health to mental illness. I think probably most of you on this call know that mental illness are medical disorders that require treatment. They're very common around the world. As many as 1 in 5 families are directly affected by mental illness in the lifespan. And I'll spend more time thinking about it. But one way I sort of conceptualize mental health versus mental illness is similar to the way we think about other things that can interfere with our wellness and our functioning versus disease. So for example, having a sprained ankle or a strained ankle, which I do now, I don't think anything is seriously wrong with it, but you want to pay attention to things that can make that better, exercise or worse, rest, exercise, staying off your foot, that kind of thing. There might be some over-the-counter things that help. Our blood sugars can fluctuate during the day outside of having any sort of medical illness like diabetes. So you all know when your blood sugar dips and what you need to do to make sure that your blood sugar stays steady in terms of proper nutrition, regular meals, avoiding alcohol and an empty stomach, etc. Now these at the bottom are the medical illnesses that, as you can see, diabetes, orthopedic injury, disease, and mental illness all require medical intervention. So it's important in thinking about mental health to think about that time when it transitions into something that requires an assessment and or treatment. Mental illness responds quite well to treatment. So it's what a lot of us are doing here in the community is trying to make sure that people do get connected with the help that they need, which is difficult. Here are some of the major psychiatric disorders. And again, depression and depression have the same name. The mood state is the same name as the illness, but there are some key differences. But it's really important for us all to note that depression and mood disorders and anxiety disorders are among the most common and the most disabling in the world. And you can just see here from this one bit of data that depression alone is more disabling than all of these other conditions. And part of the reason for that, we don't exactly know, but it's the early age of onset. People spend more of their lifetime with the illness, and most people don't get the help that they need. Same with anxiety. There's anxiety that we all feel much of the time, and there are anxiety disorders. And they differ in terms of duration, intensity, chronicity, and impairment. I've included some important resources that are national resources. Here in our local community, Nicole will probably speak more about this, but 211 has a mental health navigator who can help navigate people through resources. We have our local mental health directory that I actually don't have up here, but you can find it through the Mental Health Council, the Big Bend. And I'm going to switch now to maternal and child mental health in the community with the time that I have left. So we have 2 programs, one on the maternal side, one on the pediatric side, to improve detection, treatment, and outcomes associated with perinatal behavioral health, mental health, and substance use. And these are partnerships with the Florida Department of Health and the Florida Maternal Mental Health Collaborative, which is a statewide network of stakeholders who all come together to figure out what we need to do in the state of Florida to better address maternal mental health. Our vision is that no perinatal woman in the state will be untreated for perinatal disorders. Currently, unfortunately, about 65% of women with these disorders are not treated. And so we have a long way to go in terms of getting access to care for all of these women. The wonderful thing about this project is all of our fantastic collaborators, and you can see our list of collaborators here. All of these groups are actively involved in this effort to improve perinatal mental health throughout the state. We have our wonderful team listed here. Dr. Duggan Hansen is on the call today. Some of our collaborators from the Department of Health. And the crux of the program really is access to psychiatric consultation for obstetricians throughout the state. So obstetricians can call Dr. Roussos Ross, who you see here, who is a board certified psychiatrist and OB-GYN, and get consultation on how to diagnose and treat the women in their offices. And this psychiatric consultation model has been found in other states to drastically improve obstetrician comfort level and ability to treat behavioral health issues in the setting. Dr. Amandla Shabaka-Haynes is our resources and referral specialist, and she will talk through resources and referrals statewide with families and obstetricians. So the components of the program, in addition to the psychiatric access consultation, is our comprehensive resource directory for maternal mental health throughout the state, and then training.
2 minutes, Dr. Flynn.
Thank you so much. Perfect. Training and technical assistance for our obstetrics clinicians and for our behavioral health providers. And so we're doing trainings. We're doing one tomorrow, pretty much every week, for OBs and for behavioral health providers. And you could see where our reach in the state are all the colored counties. But we're really trying to reach all the counties by the end of the grant period, and we're hoping to sustain the project. I just have a little bit of data on the program, but I'm going to kind of skip over that. We have 133 providers enrolled in the program, and we're working on more. I think I've already touched on this, but you can see the screenshot of our website where we have toolkits and resource directories for the state. Importantly, for both of the programs, we weave in information, training, and assistance on health equity and reducing health equities. We have our 8-point plan, and we continue to keep ourselves accountable to continually address health equities throughout this program. I'm just going to spend my last minute on the pediatric side. We have a very analogous program on the pediatric side funded by the Department of Health. And you can see our fabulous team here. We are part of a statewide network of 7 hubs throughout Florida, including University of Florida, University of South Florida, Miami, FIU, and others, where we're partnering with pediatricians to provide training and technical assistance to better address behavioral health in the state. We have our fabulous local pediatricians and behavioral health providers. We're trying to get standard screening measures throughout the state, and again, providing telepsychiatric consultation to pediatric physicians. So we do a customized training plan for the pediatric sites. The whole goal here is to improve the capacity of the pediatricians in the state to both expand their scope of practice with behavioral health and also to shore up our behavioral health referral outlets. So I'm going to stop sharing, and thank you so much for your attention. There we go. I've stopped sharing successfully. And we will move on to our next speaker, Miss Courtney Atkins. So Ms. Atkins, if you want to pull up your slides while I introduce you. This is a good segue because Courtney Atkins and Whole Child Leon is our partner in the pediatric program. Courtney is the executive director of both Whole Child Leon and the South City Foundation, where she leads collaborative efforts to urge open communication and sharing resources between agencies to improve outcomes for kids and families. Some of the initiatives under her leadership include the community-wide developmental screenings that are free for young children, the Summit on Children, which is fantastic, Equity Tallahassee Leon, and which we'll talk about today, the Tallahassee Pediatric Navigation Program. She was instrumental in building the South City designation of a purpose-built community. And she also has received the Joseph Cullen Award from the National Association of Chronic Disease Directors for the Whole Picture of Health initiative. She is an incredible leader in our community. She's a convener, a facilitator. It's hard to imagine anything in town that pertains to child and family health that Courtney has not participated in some way. So I'm really pleased to have her share her work. So welcome, Courtney, and I'll turn it over to you.
Thank you so much, Dr. Flynn. I appreciate this opportunity, and thank you for that warm welcome. Before I share information about the Pediatric Behavioral Health Navigator program, I think it's important to provide a little information and background about Whole Child. So I'm going to be really brief about this, but in the year 2000, former Governor Lawton Childs began working to unite entire communities around the goal of providing for children. The Whole Child Project was created to build a stronger foundation for children across the state by focusing at the community level. In 2004, Leon County was designated a whole child community around the goal of providing for children. So what does Whole Child do, and how do we make an impact? We collect our community's data and we work with providers and parents alike to identify gaps in our system of care. What are the needs of our children and families, and how can we best address them? We then try to convene the right players to determine how to address the gaps and critical issues that are negatively impacting children. We don't replicate existing programs, but we try to connect programs and create initiatives to meet those needs. Our number one goal is to build community ownership and participation around child well-being. For the past 18 years, we've worked to establish our community voice at every table interested in serving the needs of our children. And in many cases, we provide the table for partners to coalesce and problem solve. We aim to be a catalyst for change in this community. We start by collecting and analyzing available local data focused on child well-being. We then group these data points together in key areas to identify progress and gaps in our service system. While we conduct the analysis on an annual basis, we publish a report complete with recommendations for future community action every 3 years. Our 2021 report focuses on 10 critical issues impacting child well-being and highlights the inequitable distribution of poverty in our community. So this analysis guides our discussions that we have with our community partners and stakeholders. It determines where Whole Child should focus our efforts and who we should bring to the table, and how to create better ways to secure a brighter future for our kids. Many times our initiatives go on to live with community partners. We like that when that happens, but we do have several ongoing initiatives that we facilitate. As Heather mentioned, we coordinate 3 free community-wide developmental screenings for young children every year. We host the annual Summit on Children. We have a breastfeeding policy work group. We have an initiative called Equity Tallahassee Leon, pop-up preschool, and we also have the Whole Child Leon Professional Network. This is a monthly meeting that helps us stay informed. We provide a forum for executive directors and frontline service providers representing a variety of sectors, including faith-based, human service agencies, healthcare, education, to collaborate among themselves and with community advocates to identify those gaps and needs of children and families. One such gap that recently came to our attention was that there was no provider in the Big Bend area serving sex-trafficked children and youth. So in July of 2021, Whole Child Leon became the Open Doors Outreach Network provider for this population. And finally, I'm going to share information now about the Pediatric Behavioral Health Navigator program. This initiative is in partnership with the Tallahassee Pediatric Foundation, which is a membership organization of pediatricians and primary care physicians, and the College of Medicine Center for Behavioral Health Integration. In about 2017, members of the Pediatric Foundation approached Whole Child requesting support for what they saw as a critical issue impacting their ability to support the behavioral health needs of their pediatric patients. The doctors shared that when children presented with behavioral health issues, they didn't have the information they needed to connect the child with the appropriate service. Approximately 21% of children and adolescents meet diagnostic criteria for mental health or substance abuse disorders, which impairs their functioning, yet only about 20% are receiving the needed services. We know that rates of depression and anxiety have doubled globally since the pandemic. In fact, in 2021, the American Academy of Pediatrics declared a national emergency in children's mental health. Our vision, really in short, with the Behavioral Health Navigator program is to assess the comprehensive behavioral health resources for providers who care for children, regardless of the family's ability to pay. We want to optimize the developmental potential of children and families by providing prevention and education access to effective and available treatment interventions. We want to provide interventions based on the principles of child development and child psychopathology. And we want to focus on the importance of family involvement in the treatment interventions. and we use data to improve and refine our approach to child and adolescent behavioral health services. Along with the Whole Child Lead on Board, the Alliance is an advisory committee made up of pediatricians, psychologists, and clinical social workers. They help provide oversight of the program, share best practices and information, and they provide a perspective from both the physician and the behavioral health provider point of view, which really helps us maximize our ability to integrate and enhance collaboration among the two. We're intentional in our work with community behavioral health providers. We do our best to know their practices and the services they provide in order to make the most appropriate connection for the children and families we serve. This can be challenging as providers and services come and go, and HMO panels are not always updated to reflect the practices that are not accepting new clients. So children and families access our program through a referral from their primary care physician. Once we receive the referral from the children's doctor, we provide a thorough intake assessment. We identify needs and create a referral plan and provide a warm connection to those appropriate services. And we keep the doctor informed along the way. Community outreach is really critical to our work with this program. In addition to working with PCPs and behavioral health providers, we share information about the Navigator program and its referral process with school psychologists, social workers, and after-school providers and other community-based organizations serving children. We do remain connected to families and providers to ensure that services have been initiated, and we track the progress to keep referring the referring physician informed. When we do close out a case with a family, it doesn't mean that the child cannot come back through our program for services. Kind of a snapshot to provide a little context of our clients that we serve. The majority of the children coming to us are between the ages of 1 and 4 and 13 and 16. 62% are Medicaid insured families, and 22% of the children we see have an adverse childhood experience assessment score of 4 or higher. We see an average of 60 to 70 children, families per month. We partner with and receive referrals from 74 different physicians in Leon County. We have practices that refer between 8 and 10 referrals per month, and then other practices that might refer one patient every other month. We are currently working with about 25 behavioral health providers, and because we connect our families to additional resources, including crisis intervention services like food banks, domestic violence shelters, and other social services programs, we work with many other providers in the community as well. So like all programs, we have some challenges. We're 4 years in now, and we are continually assessing our processes and practices to help us better serve the doctors, the behavioral health providers, and most importantly, the kids. One of our greatest challenges we face is the need for increased communication among behavioral health providers and primary care physicians. If we're to serve the whole child, it's really critical that doctors and behavioral health providers are communicating and collaborating on the patient's care. Another challenge is a shortage of behavioral health providers offering psychological evaluations for young children 0 to 5, which can impede or prevent that critical early intervention. Another challenge we see is the need for PCPs to provide us with a more robust description of behaviors and symptoms as it relates to the child's environment. I'll share a situation we had that illustrates this point. We were referred a child with a request for an autism evaluation due to a speech concern. The behavioral health navigator provided the consultation, and it was revealed that the child was in the home with his father when his father committed suicide, and it was at this time that the child's speech regressed. So, and the doctor was unaware of that. Now, that's not always the doctor's issue, but it's just really the importance of looking at psychosocial factors, not just physical presentation. We see a lot of behaviors related referrals where trauma is involved. So after 4 years, we've received approximately 4,500 physician referrals. We continue to advocate for improved integration of behavioral health services for children, to include working with local HMOs to expand their panels. Through our partnership with the College of Medicine and Dr. Flynn and her team, we're better equipped to apply current research related to integrated behavioral health and all the
2 minutes.
We're continually assessing our program process to provide better service. We're really proud in the last 3 months, we've been able to reduce our no-show rate from 25% to 16% by really just a simple adjustment in our process. Basically, until we received our release of information and documentation from the parents, we don't schedule with them, and that's really helped. It's amazing how you get that information when they think they might not be able to get to come in. So that's been great. We're proud of the this community program, and we do appreciate getting positive feedback from the docs we work with and the families. However, we do routinely request feedback from parents and pediatric providers so we can continue to improve the quality of the program. And finally, our office is centrally located in Midtown on Lee Avenue near Tallahassee Memorial Healthcare. And we have a presence on social media, and we have our website. So I really appreciate this opportunity to share.
Thank you so much, Courtney, and for all of your wonderful work. Speaking of sleep, I'm not sure you actually ever sleep. So it's so appreciated. So Courtney talked about the Pediatric Behavioral Health Navigation Program, and we will now shift to Miss Nicole Everett, who will speak about community mental health navigation. Nicole can tell you more about her role. She's a community behavioral health navigator for the Florida Department of Health in Leon County. Since 2017, she served on the Mental Health Council of the Big Bend with Dr. Close and Courtney and Dr. Reeve and I. As a mental health advocate and champion, and that is for sure. She's responsible for providing referral information for residents and communities in need, offering psychoeducation about behavioral health, risk signs, symptoms, treatments, supplemental social services, and especially those warm handoffs to behavioral health, which we all know is so important. And then she follows up with the individuals, which is another key piece of the navigation. Also, Nicole is the creator and host, as you probably know, a local celebrity of Conversations with Nicole, which is a talk show focused on connecting the community through conversations. On Conversations with Nicole, she leads interactive live broadcasts on Facebook, YouTube, Roku, featuring Black and Brown counselors and therapists seeking to normalize conversations around mental wellness and communities of color. I just could not be happier to have Nicole in our community. She's wonderful. I'm going to turn it over to you, Nicole, and I can share your information when you're ready.
Thank you, Dr. Flynn. So I'm going to need to get one of those PowerPoint classes so I can have some fancy slides like y'all. Okay. So I'm used to just talking, but we're going to get some nice slides from me sooner or later. So greetings, everyone. I'm so glad to be here with you. I'm about 6 months into this position. I am building the plane as I fly it. So, I'm learning and growing day by day, but I'm so glad to be doing this work. And I see several of my mental health counselor of the Big Bend comrades on here, Dr. Reeve, Dr. Fields, Tanya Tatum. So thank you all for being here. Really appreciate that, because that's actually kind of where my real advocacy, and I see you, Nancy, as well, in this space kind of began. And this was actually through doing my show Conversations with Nicole, and connected with the council back in 2017. So I will just say that the council has been very instrumental in trying to get the word out about mental health and wellness in the Big Bend. And Dr. Reeve, you put in the chat, and Dr. Flynn, the link to the Mental Health Council's website. So mentalhealthcouncil.org is the website. And on the website, and I don't know, Dr. Flynn, if you can go there and kind of pull it up, there is a directory of providers. There's a directory of service providers. She's walking us through that right now, but it lists the providers here in the Big Bend, and you can scroll down and access that link, be either web or mobile, And then it'll take you to a page that actually is managed by 211 Big Ben. But I tell you, 211 Big Ben is the best clearinghouse I have ever run across. I've met with them at least 3 times since I've been in this position, and they do a wonderful job of pulling this information together. But as you can see here, as it pulls up, you can identify a counselor based on their specialty, insurance, whether or not they are male or female. There's just a whole cadre of items that you get to select from. There we go. Race and ethnicity, whether the treatment is group or family or individual, the type of sessions you want. So this is a resource we want to drive people to, right? In terms of getting that mental health, connecting with service providers. So if you've never seen that, definitely jot that link down and please refer folks to it, because it is a very comprehensive list, and only licensed clinicians are on this list. Okay, only licensed clinicians. The other resource I want to point you to is a brochure that, again, the council put together, which talks about the different resources that are available here in the Big Bend area. So there are crisis lines that are 24/7 to help for suicide, violence, and abuse. And those include, of course, 911, but then there's the mental health crisis line, which Appalachia facilitates. There's, of course, 211. 211 has, a great group of folks on there that are, just willing to help and assist with, point folks in the direction of whatever services they need. Of course, there's the 800 National Suicide Prevention Lifeline. There's the National Crisis Text Line. There's a 800 number for reporting child abuse, Refuge House, domestic violence hotline, and then Capital City Youth Services. For mental health hospitals, you have Appalachia, of course, Capital Regional Medical, Tallahassee Memorial. For drug and alcohol and 24/7 emergency care, of course, there's Appalachia Center for Detox. And then there are IOPs, or intensive outpatient, and PHPs. I'm learning all the alphabets now, y'all. Partial hospitalization as well. So those things are listed as well. But I also want to point out that all 3 of our universities here in town, FSU, FAMU, and TCC, all have counseling centers with their, whole teams there that are serving our college students. And then there are also supports for children and families, as Courtney has pointed out as well, with the Pediatric Behavioral Health Navigator program. And then there's the community action team, the CAT team out at Appalachia as well. Some of the resources that I have been pointing people in the direction of are the FSU Behavioral Health Office Clinic. They are offering low and no cost counseling services, and I've been over there a few times to meet with their folks, and they're doing a great job, and they are in need of folks. They really want to see folks that are uninsured, so definitely trying to send people their way, and they're right over there on Lee Avenue. And I don't know, Dr. Flynn, if you could pull that flyer up as well, but they're open Monday through Friday, and again, just doing a great job of providing services.
I'm trying to share it. I'm having some technical difficulties.
Okay, that's fine. But we'll get that information out to the viewers or to the participants if you don't have that information. But again, Lee Avenue, they're doing great. And then one of the other resources that I've visited a few times is at the Lincoln Center. This is free counseling that's offered Monday through Friday, 9 a.m. to 1 p.m. to the community. You don't have to show anything. You don't have to show any ID, no proof of residency, no nothing. You just call a number and you make an appointment and she'll see you. Okay, so there's the FSU Behavioral Health flyer. So this is Lincoln Center is located at 438 West Brevard Street, and there is an African American woman there, Ms. Charmel, and she's there waiting to serve folks. So I definitely, again, am promoting this one heavily and trying to get people over there to visit with her, because she is there waiting to serve folks. Some of the other low and no cost counseling that is being offered in the community is at the Bond Community Health Center, located on Gadsden Street, and also CarePoint, which is over on the corner of Magnolia and South Monroe. Neighborhood Community Health Center over on Orange Avenue. And then the other two that I just named, the FSU Behavioral Health, is in Lincoln Center. So those are the ones that I'm aware of. Now, again, I'm learning and growing. So if there are some other resources out there, please, by all means, share them with me. Because, again, I'm still 6 months in, still learning, and building. I will share that we definitely have been doing a lot of outreach as it relates to going to the community centers. I've been to a few events that have taken place in the community. In the events, I'm talking about like Boys and Girls Club, Health and Wellness Expo, participated in the Rotary Club, Southside Thanksgiving dinner giveaway. There's a farm share that I'm active in every month. So I'm just trying to get the word out as best I can about these services and what's going on. I will share some of the barriers, if you will, or gaps that I am kind of seeing. Still, there is stigma associated with mental health and wellness, in particularly in the Black community. Some of the response that I'm getting while having these conversations are, "I'm not crazy," or "that's for crazy people," or "I pray." And so, having to have those conversations around that your God and mental health can coexist, and God created counselors and clinicians. And so it's okay to do both. And that, your definition of crazy might very well be you, in terms of maybe the depression that you might be going through, or the anxiety and the stress. Those are all mental health issues. And so, it's okay to talk to somebody, outside of your family and your friends, because sometimes we have our own thoughts about our people, right? And, they don't understand, right? So having somebody that is neutral, third party, that you can talk about these things to, is important. So definitely trying to get that message out. I will also say that a lot of the clinicians of color I've found, they do not accept insurance, and their sessions can run about $150 an hour. And that can be quite cost prohibitive. I have found that some of the reason why they don't accept insurance is that they're small operations.
About 2 minutes.
Oh, wow. Okay. That time went fast. All right. They are small operations, and if the paperwork may be too extensive, or one of the other things that I was told is that sometimes the insurance companies limit the number of sessions that can be done, and that the counselor has to diagnose the patient with more extreme conditions in order to get more sessions, and they don't want to do that. The other thing that I think would be helpful, and I don't know if this exists because I haven't found it yet, is if clinicians had a network of sharing information amongst themselves, because I have found that there's not really a group that kind of comes together and shares information about things. Like, I've told some of the ones that I've met with about these free mental health services at Lincoln, and they had no clue that anything like this existed. And so maybe that's something that I create on this journey of being behavioral health navigator. So we'll see. But I'm thoroughly enjoying this work. I will put my phone number in the chat so that folks, in my email address with DOH, so folks can reach out. I'm very interested in partnering with you in doing presentations, within your organizations around mental health and wellness. Or if I'm not the person to do it, I will, put together a group and I will just quickly share. I'm doing a mental health sessions for the seniors at the Smith-Williams Centers, and these are predominantly African-American seniors that are there. And I put together a team of Charmel, who's over at the Lincoln Center. I also have Miss Julia Shelfer with the FSU Behavioral Health Clinic, and as well as our own Miss Dora Strong and Miss Deborah, who do a skit around mental health and wellness. So these are my speakers for that presentation, which will be on Friday, March 18th at 10 a.m. at Smith-Williams. It's a breakfast and learn session that we're doing. So super excited about that and would love to do more of that type of work. So I think that's it for me.
Wow. Well, thank you so much, Nicole. That was an amazing glance at some of the resources. And I just, really excited about your role in the community. And I think you're right. We should have some sort of a way to come together, as a mental health community, not just the council, but the counselors in town. That would be really great. So without further delay, thank you. I'm going to turn
Dr. Flynn, one last thing. Sure. And this is a shameless plug. I'm going to preface it right now. So you mentioned in my bio, I do these shows every Monday and Wednesday, 8:30 p.m. Conversations with Nicole, YouTube, Facebook, and Roku. Tonight's presenter or guest is Dr. Chad Lennon. He's in Rockville, Maryland, and he's a child psychiatrist. And we're going to be talking about how to help your child manage stress.
Wow, that sounds great. Thank you for that note. 8 p.m. YouTube.
8:30. 8:30.
Okay,
yeah.
Great. Thank you.
Uh-huh.
Okay, I'm going to turn it over now to our committee member, Dr. Meredith Pooler-Burgess, to introduce Dr. Franti Close.
Thank you. And thank you so much, Nicole, for your presentation and your advocacy and the work that you're doing. I really enjoyed hearing about it. And it gives me great pleasure. I can go on and on about the pleasure I have to introduce our final panelist, Dr. Franti Close. She is full professor of behavioral science and health education and assistant director of assessment in the College of Pharmacy and Pharmaceutical Sciences Institute of Public Health at Florida A&M University. She holds her doctorate degree in pharmacology and toxicology from Florida A&M University and a bachelor's of science degree in biological science from Florida State University. As an accomplished public health researcher, she has a focus on community-based participatory research in underserved communities, and her research interests include racial disparity issues in women's health and maternal, child, and infant health. Because of her outstanding work, Dr. Close has been appointed by the State Surgeon General to the Intra-Agency Working Group on Infant Mortality Prevention External Review Work Group. She has served as president of the board of directors for the Capital Area Healthy Start Coalition twice and continues to serve on this coalition that focuses on maternal mental health and racial disparities. Additionally, she has recently been elected to the Healthy Start Mom Care Network Board of Directors for the state of Florida and is currently serving as co-investigator on the Maternal and Child Health Disparities and HBCU Partnership Initiative funded by the Gates Foundation. She has served 2 terms on the United Way of Big Bend's Board of Directors as the chair of the United Way Health Council and was instrumental in conducting research on perceptions of stress and health-related burdens among Leon County residents. Dr. Close is a member of the Mental Health Council of Big Bend, where she serves as the chair of the Engage Committee, which focuses on the stigma of mental health in the African American community. Recently, she led the Engage Committee in offering a Black men's mental health training to the Tallahassee community. So I am going to turn it over to Dr. Franti Close to finish us out with talking about men's mental health.
Okay, well, good. Thank you. That was such a pleasant surprise to have Meredith introduce me. Meredith is one of my rock stars, doctoral students. I was her dissertation chair, and so to have her introduce me, yeah, you could have just said something and not read anything. You know a lot about me, so. But I'm elated to be here. So I'm able to share my screen. Okay.
Yeah, you should be able to.
Okay, I think I'm there. Okay. I just want to say before I begin is that to be on this panel with these women is just, I can't tell you. So it's, I ran track so at FSU, and so I know the anchor leg really has to bring it home, Dr. Flynn. So, and I've done the anchor leg. So this is really great timing, the way you put this together. I mean, all of us, and how I'm ending it because Nicole actually just started, to kind of talk about some of the things that we do in the community. But Dr. Flynn asked me to go to these 3 things, and that's what I'm going to do. I'm going to just have a quick overview of Black mental health, talk a little bit about Black men's health specifically, but I know you want to hear about what we did for our Black men's mental health training. Mental health in the Black community, it's a crisis. I want us to say that again, it's a crisis. There's a lot going on and why there's a crisis. It's always been there, but now of just where we are in this world, in the pandemic and all of that, it is definitely a crisis in our community. Black Americans are 20% more likely to experience a serious mental health problem than the general population. Let that sink in for just a second. That's 20% more likely to do that, just based on various things. African Americans are making up 13.4% of the population. That's about 7 million people. But of those, only 16% of those are reported, and that's the operative word here, reported a mental illness. You really can't talk about mental health in general, or specifically Black mental health, without just talking about the social determinants of health, because that's where we're born, we live, we learn, we play, we worship, and we pray. And so all of these things make a difference in who we are as a whole, but specifically in our mental health, where we live, our built neighborhoods, our overall health, our economics. Are we stable? Do we have a good job? Do we have the education that we need to obtain that good job? What are the social and community contexts in which the person will live? And that's important. But what I want to just start off with, because it's hard to talk about mental health without really bringing home with African American or Black mental health, this historical trauma, because that's so important to kind of give us some idea of why we are seeing what we see. And it is I'm going to read this because I think it's important to read this. The collective spiritual, psychological, emotional, and cognitive distress perpetrated intergenerationally, deriving from multiple degenerating experiences originating in slavery and continuing with pattern forms of racism and discrimination to this present day. And all of that just saying that, there are a lot of things that come with being African American in society today, which then somehow makes a difference in how we view ourselves and how we deal with racism and discrimination in our everyday lives. I can just spend all of my time on this slide because there's so much in this slide to just show you that with this racism, discrimination, just the living in poverty, just not having the right amount of education to obtain those jobs, and just where we are with in those communities. But violence is also, and we see in the news every day about something happening, and it's just an issue when the violence is always, but it's most likely perpetrated against someone of the ethnic racial minority group. And again, that's a really good quote from our Surgeon General that talks about exposure to all of these things will take a toll on our overall mental health. And I think it was Courtney, she talked about adverse childhood experiences. That too is also something that we should talk about when it comes to Black mental health. These are things that impact us because of our childhood. There are things such as our physical environment, whether or not we have the things that we need, whether the child is neglected, the physical and emotional abuse that may happen in the home, and just the overall household dysfunction. And I think on Courtney's slide, she actually showed that those children had about a 4+. And, you know, after that, there are some other issues that are going on in that home that's going to take a toll on their overall mental wellness. This is just a schematic just to show you here how these adverse childhood experiences, you know, it's kind of in the middle of this pyramid, but show you that social and emotional and cognitive impairment, how all of these things can lead to early death if it's not checked and changed early on. So I really like this because from the historical trauma that I talked about, how all of this really, if we look at each of these levels, there's so much to do on each of these levels in our community. This is another schematic I just wanted to show you that there are factors that affect why we have issues with service. 63% of African Americans believe that depression is a personal sign of weakness. And I think that's what Nicole was just trying to say. That's a weakness because we should be praying about it and it should help us. But 56% of African Americans believe that depression is a normal side of aging. The older you get, you got more life things going on, more life experiences, things that are happening because you are a mom, a dad, and living in the community that you live. May also be an issue. The distrust in the medical field, not having, as Nicole said, not having the people that look like you there to understand some of your trauma and your adverse childhood experiences. And I talked about economic issues as well, access to services and having them, because you hear the wonderful services that we have access, but what are the barriers that are hindering us from getting to those services? And again, just overall lack of understanding of what mental health and mental illness is. And these are some of the barriers. Stigma is associated with mental illness. Distrust, again, as I was saying, just not, just because of the things like the Tuskegee experiment, those things, just that overall trust or distrust in the healthcare system. And again, I just said the lack of providers that have the same background, having culturally competent providers, even though the provider may not have the same skin tone, but just be culturally competent is so important. And more importantly, I will always say cultural humility is that thing that you need as well, because you need to have that, try to understand someone's culture. But of course, like we just talked about earlier, lack of insurance and underinsurance is also an issue. Also that, when it comes to seeking service, 80% of Black Americans are very concerned about the stigma. We're not crazy, as Nicole just said. It's just like life has just happened to me. It could be situational, but 80%, that's why it's a crisis. It's a crisis because that's a lot of people who are not seeking care. And this is just a definition about mental health stigma because it is a stigma. There are the negative assumptions, that attitudes about individuals who experience mental health conditions. And it pretty much is saying that it's your fault that you're having this mental health breakdown or mental illness. This is also a schematic that when they surveyed, this was a survey done for African Americans, 63% of them said that they view depression as a personal weakness, which also confirms that last statistics. And also 30% reported that they will deal with depression themselves by praying, by doing all those other things that they think are assisting them. 33% reported that they would accept medication if that's offered. But again, we talked about not having access to those types of services. This is the one that gets you kind of scared here. And this is the one that I want you to pay attention to. And this is why I think we are doing, especially on our GAGE committee, doing what we're doing. Now, everybody, look at the green line here. This green line is just the overall suicide rates in the country. This blue line represents the Black population. From 2010 to pretty much the present, You see, something was happening in 2015 and we're creeping up. And that means that our African-American Black people are dying for some things that, remember I talked about those social determinants, right? So those things that they think that they cannot, navigate through. So the thing is that what we really want to talk about is, how is this affecting overall? Like I said, that line really does give you something, a time to just pause and say, why is this happening? We decided that we wanted to do something about this. Okay, always when things are happening. So with this, July was Minority Mental Health Month, and we, as the Engaged Committee, along with the Mental Health Council of the Big Bend, and shout out to all of the Engaged Committee members that are on, because we were looking at how we going to do something in our community. We know that in the Black community, the barbers, coaches, mentors, all of these people have an impact on our youth and other African Americans in the community. So here is our flyer that we had for our training. We had, it was a collaboration with the City of Tallahassee, the Mental Health Council of the Big Bend, the Black Men's Mental Health, and it was held here on our campus. We had a Sunday dinner. The participants received a $25 gift card to Walmart. We raffled off a flat screen TV. We had a QPR training, and thanks to our FAMU Counseling Center staff, Dr. Marquis Stewart and Mr. DK Stanzel. And we also had Dr. Kenneth Fowler, who talked about being a Black man in America. And also we had another member, Ms. Tanya Tatum, who's of our Student Health Services, talk about COVID-19 vaccine hesitancy, because we know that COVID-19 also is impacting the overall mental health of African Americans. So this is just to show you that there's a lot of men out there that need this help. So we're going to continue to try to do that. But I want to just make a point right now to the training was really headed out by the people. See right there in the middle, the Engaged Committee. And I'd like to thank, again, Ms. Nicole Everett, Nancy O'Farrell, who's here, Dr. Nico Fields, Courtney Atkins. So you see how we all are a part of this committee, Ms. Beth Dees, and of course, Tanya Tatum and Janae Freeman for all the work they did and all that we did to make this successful. And of course, the Mental Health Council of the Big Bend. I also listed two of my doctoral student, Michael Birdsong and Nicholas Afford. And I did mention John Brown of the Black Men's Mental Health. So just thanking all of the training, the participants, it was absolutely wonderful, because a lot of men, we gave them a great space and place to have a time to just talk about some of the issues. There was a lot of crying. There was a lot of time of openness and anger, all of that, because we created that space for them to share the issues. And a lot of the issue was around fatherlessness, not having a father in the home and how that they could be a father. So I'm going to conclude right here. This is what we say in the Engaged Committee. If you want to go fast, go alone. If you want to go far, go together. And I guess with my brief time here, just to tell you, it's going to take all of us doing this together to make this successful in our community. And again, I think the best committee on this side of Tallahassee is the Engaged Committee, all of them and all of their work that they're doing and their commitment to us. Thank you all.
Thank you so much, Dr. Close. That was amazing and wonderful information. And, as always, I wish we had more time, but the good news is we're doing these kinds of things a lot, especially you and the community. And, I know there'll be other events from the Engaged Committee and other opportunities to share. Hopefully you've all learned about some resources you didn't know about before, but reach out to any of us on the Mental Health Council of the Big Bend. Call Dr. Reeve. We're all here to help direct to resources, and we sincerely appreciate you joining us today. And thank you so much to all the presenters. That was fantastic. Have a wonderful day, everybody.